Thank you for joining Consumers, Doctors, and Consumers Connect Care Network, CCN channel. This is part 2 of Cash Poor Americans. As I mentioned in my previous channel about the cash poor Americans, there are 180 million blue collar workers making 160 million blue collar workers making 55 grand a year. They're cash poor when they retire. I have given an advice how to participate. This present government has empowered you to participate in it's not high deductible, folks. It's a Healthy Dividends Health Plan. No longer high deductible. I don't like that deductible part and putting Healthy Demands Health Plan. Participate in Healthy Demand, which qualifies you to put aside money into the personal care or personal savings accounts. Beauty about it is every year you put aside 300, 400, 500 a month. At the year end, you'll have 6, 7, 8,000, and by the time in 30 years, you'll have 150, 200,000 in your personal care accounts. This really is a boom for Medicare. Right now, the Medicare recipients are cash poor because they don't have this benefit. Youngsters can take advantage and participate in this. And what they have done, the present administration, what they have done, they have liberalized the health reimbursement accounts. They are favoring more towards a health savings. Health reimbursement account is controlled by the employer, but they have passed an executive order where employer will personally fund into your personal care accounts where you have the control. You can decide what you want to use it for. Before 65, you have to use it for. How it will benefit you. This is what I'm going to address. People with diabetes, people with kidney failure, there is a problem. So people with diabetes, the present administration has said before the deductible kicks in, the insulin has to be covered by the insurance. That's a good thing because you don't have to pay from your pocket. A patient with chronic illnesses, insurance has to pay for it before you use your personal funds. Rest of them, just pharmacies. There was a gag order. I was not aware. There was a gag order against revealing price transparency when you go to the pharmacy. And you have to pay $20 copay for the insurance to pay for it. But the cost of the medicine is only $5. They won't tell you that. It's only $5 to $10. They won't tell you. So you end up paying $20. But when they remove the gag order by the present administration, this media doesn't tell you all this, folks. They have removed that gag order. So now, if your medicine is $5, you don't have to pay $20. You pay $5, and you don't need your insurance to pay for it. This is a beauty. This is what I've been telling. There are a lot of things. Even I'm a urologist. I'm a retired urologist. I'm telling you, telehealth, telemedicine, I can sit at home, see 30, 40, 50, it doesn't matter. I used to see 40 to 50 patients a day. I can do that sitting at home. How often do I have to literally see the patient? If I have to do some digital rectal exam, whatever it is, but that can be arranged. It's not like you have to have an office overhead of 40%. I can cut down my overhead. I can get the payments as I see the patients. Beauty. That's another beauty. No more billing. Take away the billing. This Medicare has literally, these numbers, the payment number, all these private insurance carriers copy Medicare payments. and they give a little more than Medicare. These Medicare numbers are cooked up, folks. If Medicare is paying, I had an angioplasty myself. I stayed in the hospital 23 hours. I got a bill for $227,000, folks. The worst part is my Medicare paid $35,000 for a 23-hour stay. How would you justify? That's your money, folks. If you have a health savings account and you have a price transparency, would you go to that facility? No. Would you go and see? These are the things. You need a price transparency in insurance, price transparency in hospitals, price transparency among the providers. As a matter of fact, what they're doing is, who is transparent in prices, they're referring it to those doctors who are transparent. You can see $19, $29. You can advertise whatever you want, but you get to see more patients, and you get to make same amount of money sitting at home or in an office, small office. You don't need a full-blown office with 5 girls. Come on. You can cut your overhead. You don't need to spend 45% of your overhead on every dollar you make. You can cut down your costs and give it back to the consumers. So people who are price transparent, they are referring more and more. So this is what it is. By having personal cash is power. I can tell you, cash is power. We all have seen it. America became rich because of consumers. They cash. If consumers don't shop during Christmas time, this takes a big hit. Amazons, Googles, Facebooks, they all enrich themselves because of you. I'm telling you, it is in your hands to be cash rich. If you don't take this opportunity, you're losing this is election has consequences, folks. You guys decide. Whatever you do, invest in yourself. This is an asset. Health is an asset, folks. It's like home insurance. Invest in yourself. Once you get insurance, you know what? Once you go through the underwriters, nobody can take it. Like a home insurance. Once you go through the underwriters, you don't have to go every year through underwriter. It is guaranteed for life. That's what they have done. If you have insurance now, it's guaranteed. It's renewable every year without question, and no questions asked by any insurance. You can go across the state line and shop for the premiums. This comes to a conclusion on part 2 and cash poor Americans. If you like this, join this channel and join me in the part 3 of Cash Poor America. Hit the notification button, make some comments. Thank you, folks. Welcome to CCM. This is Consumer's Doctor.